Good afternoon. My name is Abby. I am a doctor of emergency medicine at the Seattle Medical Center in Emergency Care. So I'm actually going out of town this week with Thanksgiving and everything coming up. So I really appreciate you taking on this case. This evening we had a patient come in. She is a 13-year-old Caucasian female by the name of Jane Doe. And she came in complaining of stomach pain in the lower right quadrant of her abdomen, as well as even more extreme pain in the lower right iliac region of the abdomen, along with nausea, which could be associated with the pain itself. So with the patient medical history, she has hypertension, which she's had for most of her life, chronic tachycardia, as well as POTS, which is postural orthostatic tachycardia syndrome. Additionally, her vitals were all elevated, which could be associated with both her issue at hand or her past medical history. Her temperature, her pulse, her blood pressure, all elevated. My clinical impression was acute lower right iliac pain of the abdomen, which could be appendicitis. Upon examination, I decided to order a CT of the abdomen, a urinalysis, and also a test to mostly check for elevated white blood count. With everything, once all the tests came back, the patient still complained of a swollen, tender abdomen. The blood test did show an elevated white blood count, but the urinalysis came back completely normal, in addition to all the other internal organs appearing pretty normal, including the liver, spleen, pancreas, everything. So we went ahead and diagnosed her with acute appendicitis. And in order to treat this, we did a laparoscopic appendectomy. However, before the procedure, pain medicine can be administered intravenously, as well as a prescription painkiller and antibiotics can be prescribed post-op as a part of the patient's aftercare. I highly suggest to emphasize the importance of proper wound care, as we just don't want infections and everything. And with the type of closure used, full submersion in water is highly not advised, although the patient is free to shower as long as there is no direct prolonged water contact, no scrubbing of the area, as well as soap doesn't need to be used directly there. She's on antibiotics. However, if soap does get in the area while she is showering, that is completely fine. So with the procedure, she will be placed in a supine manner. Intravenous anesthesia will be given in the left antebrachium or the left forearm. The abdomen is prepped with iodine. The patient did tell us that she is not allergic to iodine or latex. And then 3 incisions are given down the midline. The largest located in the umbilicus, about 2 centimeters in length. And the next being made in the upper suprapubic hypogastric region between 1.5 to 2 centimeters at length. And the last being made in the lower suprapubic region at 2 centimeters of length. Once the appendix is identified and removed, the area is ligated and divided at its base. The area is then cauterized in order to avoid excessive bleeding, and then the appendix is completely removed. Each layer of muscle will be stitched, and then the initial 3 incisions will be closed with skin glue. So obviously, like our final diagnosis is appendicitis, we did get lucky in that the appendix did not rupture, so the patient was able to leave the next day. Upon discharge, the patient was given wound care instructions, and she will be having a follow-up with Dr. Who in 7 days. So thank you so much for taking on the case. I really appreciate it.